1 in 10 women has an ovarian cyst right now, and most of them have absolutely no idea. That is not a scare statistic. That is a reality check, because ovarian cysts are one of the most common gynecological conditions in the world, and yet most women only find out they have one by accident during a scan for something completely unrelated. So today we are going to change that. In the next 10 minutes, I am going to walk you through exactly what ovarian cysts are, what causes them, how to recognize the symptoms, and what treatment actually looks like. Because you deserve to understand what is happening inside your own body before a doctor tells you something you were never prepared to hear. So what exactly is an ovarian cyst? Simply put, a cyst is a fluid-filled sac. When it forms on or inside one of your ovaries, it is called an ovarian cyst. Your ovaries are 2 small organs, roughly the size of almonds, sitting on either side of your uterus. Every month, one of them releases an egg during ovulation. Sometimes during that process, a small sac filled with fluid develops. Most of the time, it dissolves on its own within a few weeks without you ever knowing it was there. Your body is actually remarkably good at dealing with ovarian cysts on its own. Most cysts, especially the common functional cysts that form during ovulation, are not permanent. Over time, your body simply begins to break them down and absorb them. Sometimes the cyst shrinks gradually. The fluid inside gets reabsorbed into your bloodstream, the cyst gets smaller, and eventually it disappears completely on its own. Other times, the cyst ruptures, meaning the wall breaks, and the fluid releases into the pelvic cavity. This can cause a sudden sharp pain, but in most cases, your body absorbs that fluid quickly and clears it away just as efficiently. Your immune system essentially sends in a cleanup crew, specialized cells that clear away any remaining tissue and fluid until there is nothing left. So, whether a cyst shrinks slowly or ruptures suddenly, your body is often more than capable of handling it naturally. That said, not every cyst behaves this way. Some persist, some grow, some cause complications, which is exactly why keeping an eye on them with your doctor matters. But sometimes it does not dissolve, it stays, it grows, and that is when it can start to cause problems. The important thing to understand right now is this: having an ovarian cyst does not automatically mean something is seriously wrong. Most ovarian cysts are benign, meaning non-cancerous, and many resolve without any treatment at all. But some do need attention, and knowing the difference starts with understanding what type you have. There are several types of ovarian cysts. Here are the most common ones. Functional cysts. These are the most common type by far. They form as part of your normal menstrual cycle and usually disappear on their own within 1 to 3 months. Most women who have ovarian cysts have this type. Endometriomas. These develop as a result of endometriosis, a condition where tissue, similar to the uterine lining, grows outside the uterus. These cysts are sometimes called chocolate cysts because of their dark brown appearance. Dermoid cysts. These are unusual cysts that can contain tissue, like hair, skin, or even teeth. They form from cells present since birth and are almost always benign, but can grow large enough to cause discomfort. Cystadenomas. These develop from cells on the outer surface of the ovary. They can grow very large and may need surgical removal. PCOS cysts. Women with polycystic ovary syndrome develop multiple small cysts on their ovaries as a result of hormonal imbalance. These are not the same as functional cysts and are managed differently. So what actually causes ovarian cysts? The answer depends on the type, but here are the most common underlying causes. Hormonal imbalance is the biggest driver. When your hormones are out of balance, whether from stress, diet, medication, or conditions like PCOS, your ovaries can produce cysts instead of releasing eggs normally. Endometriosis directly causes endometriomas. If you have endometriosis tissue growing on your ovaries, it can form cysts that fill with old blood over time. Pregnancy. During early pregnancy, a cyst called a corpus luteum cyst sometimes forms to support the pregnancy hormonally. Most disappear by the second trimester. Pelvic infections. Severe or untreated pelvic infections can spread to the ovaries and cause cysts to develop. Hormonal medications. Fertility drugs used to stimulate ovulation can sometimes cause multiple cysts to develop on the ovaries, a condition called ovarian hyperstimulation. The honest truth is that in many cases, particularly with functional cysts, there is no single identifiable cause. Your cycle simply produced a cyst. It happens. It does not mean your body is broken or that you did something wrong. Now, the symptoms. This is where it gets important, because ovarian cysts can range from completely silent to genuinely painful. Many women with ovarian cysts feel absolutely nothing. No pain, no discomfort, no warning signs whatsoever. The cyst is found only during a routine scan. But when symptoms do appear, here is what to look out for. Pelvic pain, a dull aching pain in the lower abdomen, usually on the side where the cyst is located. It may come and go or feel constant. Bloating and fullness, a feeling of pressure or fullness in the abdomen, sometimes making you look or feel more bloated than usual. Painful periods, heavier, more painful, or more irregular periods than normal can sometimes indicate an ovarian cyst, particularly endometriomas. Pain during sex. Deep pain during or after intercourse is a common symptom worth paying attention to. Frequent urination. A large cyst pressing on the bladder can cause you to need to urinate more frequently. Difficulty emptying your bowels. Similarly, pressure on the bowel can cause changes in bowel habits. Now, the symptoms that require immediate medical attention. If you experience any of these, do not wait for a scheduled appointment. Sudden severe pain in your lower abdomen, pain accompanied by fever or vomiting. Feeling faint, dizzy, or weak alongside pelvic pain. These can be signs of a ruptured cyst or ovarian torsion, where the ovary twists around its supporting tissue, both of which are medical emergencies that need urgent care. How is an ovarian cyst diagnosed? The most common way is through an ultrasound scan, either an abdominal ultrasound or a transvaginal ultrasound, where a small probe is gently inserted into the vagina to get a clearer image of the ovaries. It is not painful, and it is the most accurate way to see what is happening. Your doctor may also run blood tests, particularly a CA-125 test, which checks for a protein that can be elevated with certain types of cysts. It is important to know that an elevated CA-125 does not automatically mean cancer. It can be raised by many benign conditions, including endometriosis and fibroids. If you have symptoms that concern you, go to your doctor and ask for an ultrasound. You have every right to request one. Cyst treatment. Treatment depends entirely on the type, size, and symptoms of your cyst. Here are the main options. Watchful waiting. For small, functional cysts with no symptoms, your doctor may simply monitor the cyst with repeat ultrasounds every few weeks to see if it resolves on its own. Many do. Pain management. Over-the-counter pain relief like ibuprofen can help manage discomfort while you wait for a cyst to resolve. Hormonal contraceptives. The pill or other hormonal contraceptives are sometimes prescribed to regulate the menstrual cycle and prevent new cysts from forming. They do not shrink existing cysts, but can prevent recurrence. Surgery. If a cyst is large, growing, causing severe symptoms, or not resolving on its own, surgery may be recommended. The most common procedure is a laparoscopy, a minimally invasive surgery where small incisions are made and the cyst is removed. In rare cases, a larger surgery called a laparotomy may be needed. Treating the underlying cause. If your cysts are related to PCOS or endometriosis, treating those conditions directly is the most effective long-term approach. The most important thing to remember, treatment is available. Ovarian cysts are manageable, and finding one does not mean your fertility or your health is over. Before I go, I want to say something directly to you. If you found this video because you just found out you have an ovarian cyst, I want you to take a breath. Most cysts are benign, most resolve on their own, and the ones that don't have real, effective treatment options. You are not broken, your body is not failing you. You just needed information, and now you have it. If this video helped you, please subscribe, because every week HealthMatta is here, breaking down the topics that matter most to women's health. Share it with someone who needs it, and drop your question in the comments. Every single one gets read. You deserve to understand your body. That is what we are here for.